Terrific. I'm going to start to make a slow start. I think I have a few acknowledgements and some housekeeping to do, and then Renard and I are going to start chatting. So firstly, I want to acknowledge the traditional owners of the land for those of you that are in Australia right now, wherever you are dialing in from, elders past and present, and any Torres Strait Islander, Aboriginal Torres Strait Islander people that might be joining us today. What little bit of housekeeping, those of you that have been joining these webinars will already know this. If you need some IT support, please post it in the chat, or you can just keep saying hi to us, which is really super nice. I will be taking questions from the audience for Renard. If you could please post them. Renard's trying to kill a mosquito, just so you just understand what happened right then if you were watching her. So apparently there's a big, awful mosquito, and I don't understand why she's not using science to like get rid of the mosquito, but she's gone old school using her hands. So I'd also like to direct you to the Q&A chat on the webinar down the bottom. Post questions, please post questions as Renard and I are talking. I will throw to questions from the audience throughout the next 50 minutes. So you're welcome to post them as you think of them, or I might call a few people out if you've all become a bit shy. Just so people know, we've got over 270 participants registered for this event. This is our 5th Evidence and Implementation Summit. We have to kind of swap time zones, so friendly for the US and then unfriendly and friendly for the UK. It is recorded, it is put up on our website afterwards, so people can watch this also in their own time, but it's nice to have a live audience to help Renard and I be very energetic. We have a number of people across Australia, but we also have people from Cameroon, Chile, Finland, France, India, Indonesia, a nice big group from Singapore I'm super proud of. Thank you for Singapore. As people know, CEI does a lot of work in Singapore. We've got Thailand, we've got some folks from the UK, Mexico, a couple of folks from New Zealand. So we've got a nice big broad audience. Can we go to the next slide for a sec, Vicky? Yeah, so just a quick, and I'll top and tail this. So these summits are a way of us trying to keep momentum up towards our Evidence and Implementation Summit that was to be in October this year. We have had, like everybody else, have had to move it to March 2021. Renard is actually one of our keynote speakers, so this is a bit of a like a taster of what's to come, which I'm pretty excited about. We have gone to a hybrid design. That means that we will have some in-person events likely in Sydney and Melbourne running at the same time, because even in Australia, we're not too sure how much travel we'll be able to do. The time zone will sort of move up towards Southeast Asia into the UK and then around to the US. Going hybrid means a lot more people can participate. The downside is we can't be together, but we promise we will make the actual event itself really dynamic and interesting. Abstracts do close on the 6th of October. I highly encourage people to get abstracts in. For those that do put an abstract in to do a sort of a more traditional 15-minute presentation, we're going to pre-record those that are accepted before Christmas. We will then release that content ahead of the event, which means if you've registered the event, you can watch all that content in your own time. And then the focus of the 2-day event will be very much live, invited speakers, panels, so we can be a little bit more creative with what we're doing. We'll have panels that will combine people in person and online. We've got a good IT company we're working with. For those of you that join from Singapore and or London, we will also, as part of your registration, host a in-person dinner and some sort of invited speaker in each of those cities associated with the summit. Unfortunately for the US, we've had no takers wanting to do that yet. I tried, Sir Renard, and I think the fires over there and COVID have depleted folks' energy of thinking about anything else, but you never know, folks in the US, we might be able to get there. So please get your abstracts in, and then the program will go up really quickly, and we're hoping people register. You know, back to the slide with Renard on it. So I want to introduce Renard, but I'm going to let her talk a little bit about herself. So Renard Bates is a superstar in the field of behavioural and implementation science. I am so thrilled when she said yes to keynote the conference, and equally thrilled when I said, can you do one of these webinars? I know people are getting a bit over it. But as you'll see, there's a lot Renard's going to share with us, and she's extremely engaging. So get your popcorn, get your bourbon, get your cup of tea. As I said, we'll go to about just before the hour. Put Q&A questions up as we are. Renard will tell her career story as we speak, so I'm not going to do too much intros, and you also have her bio on the information you were sent. But great title. How is behavioral economics relevant to implementation science? I deliberately asked Renard to talk about this topic. It's a bit of a hot topic all over the world. So Renard, there are a bunch of terms being thrown around in the description for this webinar. Terms like implementation science, which might be quite new to a few folks. We talk about behavioral economics. Some folks on this call also talk about behavioral insights. You reference evidence-based practices. If you just to sort of help kick us off, if you could take us through just a few definitions of some of the key terms we'll be talking about to help people understand. Over to you.
Sure. Well, I first just want to start by saying thank you for this invitation. It's such an honor to be here with you, Robin, and I know you're going to keep me on my toes. So I brought my bourbon. It's 8 p.m. my time. It's acceptable, and I'm prepared.
So much.
No, I really am it's a huge honor, and hearing the global audience that's here is just so exciting to me. And so if anyone's looking for an implementation scientist to come visit them in all the countries you mentioned, when this is all over, I'm going to be itching to do a lot of traveling. So give me a call. So thank you so much for suggesting that we start off by defining our terms, because I think one of the most confusing things about this field is the proliferation of terms that not everybody is always on the same page about. So I'm going to define the terms the way that I understand them, but Robin may disagree, and I'd encourage you to speak up, and others in the audience. But this will be kind of the perspective that I bring and the way that I think about it. So when I think about what implementation science is, I'll start with kind of my lay definition, or what I tell people I do when I used to go to cocktail parties. When I think about implementation science, fundamentally for me at its core, it's about moving the needle in health and mental health quality services, and ensuring that all of these evidence-based practices that we have, and I'll define that in a moment, actually reach the people who need them, and that all of the scientific discovery that we spend millions and billions of dollars on actually achieve their potential. If you want the textbook definition, I'll go to the Eccles and Mittman 2006 inaugural definition from the Implementation Science Journal, which is the scientific study of methods to increase the adoption, implementation, and sustainment of evidence-based practices into routine practice. And I can't remember if their definition also has the kind of emphasis on the end goal, which is to improve people's lives. But I think it's really important to kind of always be thinking about why we do implementation science. It's not an academic exercise. It's the most applied science we have, and it's really about moving the needle and improving lives. Then I'll just touch on what evidence-based practice is. For me, evidence-based practice is taking the best evidence that we have from our most rigorous scientific trials, including clinician judgment and patient preference. So I think about that three-legged stool definition when I think about evidence-based practice, and wanting to be sure that we have lots of perspectives represented. And, I'm a hardcore scientist at my core, but I think I just got it. I got it.
Oh, well done.
I think
that's an evidence-based strategy to keep her behavioral. Well done. Well done. Your work here is done. You could go.
Done.
Yeah.
I do think it's important to have a more expansive definition of evidence-based practice than perhaps something like empirically supported treatment, which really, focuses on the science behind the practice. And that leads me to the last kind of thing that you asked me about, which is behavioral economics. And I want to lead by saying I'm trained as a clinical psychologist. And at its core for me, behavioral economics is the best of psychology applied to decision-making. And so while I'm not a behavioral economist, I'm not trained as an economist, I want to be really upfront about that. The more time I spend learning about behavioral economics from my fabulous colleagues who are the experts who've really helped me think about how to integrate these approaches into implementation science, the more I've realized that I'm kind of coming home. Because, you know, in my mind, behavioral economics is really a beautiful application of psychological factors and principles that help us understand how we make decisions as humans and how we behave. And it's called lots of different things. You know, I've heard it called behavioral science, behavioral economics, behavioral insights. Some people say, isn't this just psychology? And I've kind of spent a lot of time trying to wrap my head around it and read some books and talked to colleagues who are experts. And from what I can tell, behavioral economics is really kind of stems from the work of early cognitive psychologists, Tversky and Kahneman. They identified these curious ways in which we make decisions that don't kind of align with what we might think would happen. And then it was adopted by Richard Thaler, who recently you know, won the Nobel Prize for his work in behavioral economics, and other economists who realized humans, we don't maximize utility, or we're not perfectly rational in the way we make decisions. So just to give you an example, and I'll pause after this, there's something called the endowment effect. So take this bourbon, let's say I bought it for $10 and I aged it for years, which would never happen because bourbon doesn't last in our house. And now it costs $200. So if I were a perfectly rational transactional human, I would sell it immediately. I would not be drinking it right now because I would be able to get $200 for something I paid $10 for. But because I'm human and I experience the endowment effect, I want to keep it. It's mine, and I like drinking this bourbon. And so that's just an example. And you know, Richard Thaler noticed these curiosities in how humans were making decisions that didn't align with kind of a rational economic approach. And so that's my understanding of behavioral economics, and encourage, you know, you and others to share your insights.
Oh, no, that's very, I mean, again, trained as a psychologist myself and actually trained as a behavioral psychologist, it does seem to me an area of work that just seems such a natural part of both behavior change, implementing new things, and fits perfectly with the field of implementation science. And to me, it's part of, so implementation science kind of involves behavior economics, behavior insights. So on that then, Renard, with your fancy bourbon, what I would like to know is just talk a little bit about how these things fit together, because one of the concerns we've had is I work with a lot of behavioral economists as well now, and they have very strong, deep, and great knowledge of understanding how to use that science to kind of change and improve or achieve certain outcomes around behavior. But their knowledge or alignment with implementation science often isn't as much, and the two areas of science can sometimes be said as behavioral insights or economics and then implementation science. And you'll know we've had a preference of trying to combine these two, including the center that you founded at the university. So can you just talk a little bit about what your thoughts are on the intersection of them, or maybe the difference, or pause there?
Yeah, absolutely. So the first thing I want to say is that I think both fields would do very well to learn from one another. I know that I've learned tremendously in my interdisciplinary collaborations with behavioral economists with regard to really thinking deeply about how to make it easy for clinicians, I'm putting clinicians in quotations, whoever you're trying to get to change their behavior, to do what you're asking them. I find, you know, in drawing upon my work over the past 15 years in the field, that in implementation science, we've often in the past leaned on knowledge, you know, training, trying to change people's behavior through, you know, just giving them new information, when we know that's kind of the least potent way when we look at the behavioral economics and insights literature to change behavior. And I'm really drawn to some of the work around, you know, changing the choice architecture or making the environment support behavior change in a more effective way. And, you know, I want to be really upfront and say there are lots of groups nationally and globally applying these ideas in many different contexts. Particularly at the, you know, the government level, I think of, you know, the BIT in the UK, thinking about how to change human behavior to make people more healthy or to save more money. One of the things that's really cool for me is that we have a leading group at Penn that's led by Kevin Volpe, who's a leading behavioral economist, in applying
and quickly,
those insights.
PEN is, just
yeah.
for the audience, PEN is what? Just because
Sorry.
some people won't know what you mean. Yeah.
Right. Exactly.
Yeah.
Thank
I'm
you.
here to help, buddy.
University
I'm here to help.
The University of Pennsylvania, which is the institution in which I work. And so, you know, I'm very lucky in that I have a number of colleagues who, you know, do this work and have been at the cutting edge of applying behavioral economics to clinical decision-making in a clinical setting, but not in mental health. So they had been doing landmark trials around smoking cessation and weight loss, really targeting patients mostly, but, you know, also doing some work around targeting clinicians, and demonstrating that when you incorporate insights from behavioral economics into the interventions targeting patients, that you get better health outcomes. And I was always drawn to that work because it seemed very elegant and thoughtful, and drew from this deep bench and this deep literature. And then more recently, there's a colleague at the University of Pennsylvania, Mitesh Patel, who started leveraging the electronic health record to nudge clinician behavior towards making the optimal choice. So just to give you an example, there was this really cool study where they changed the default in the electronic medical record from a brand name drug to defaulting to prescription, to off-label drugs. And they saw this massive change in clinician behavior just from this slight tweak. So the thing is, we're being nudged all the time, but we can make these changes in our ecosystem to make us you know, more effective, and to make it easier for us to make the right decision. And, you know, there's a Freakonomics episode, which is a podcast about this, and it's called Saving $32 Million in 1 Hour, where he's featured talking about this. But I would, you know, we started hearing about this work and thinking, what's the analog in mental health care? You know, why aren't we applying some of these concepts in implementing evidence-based practices in mental health? And my early work was all about, well, let's train people. Let's give them ongoing support, you know, and really focus on context and organizational culture and climate and leadership. And those things are also really important, and I'd love to chat a little bit about them if we have time. But I didn't feel like we were leveraging some of those really wise insights that were demonstrated effective within implementing evidence-based practices for mental health care. Let me pause there, and I have lots more to say about this, but I don't want to.
Well, that sounds like you're sort of, you're talking a little bit about how you came to it from what's, you know, your story in terms of coming to behavioral and implementation science. So maybe just keep going there, because it is a little bit very similar to those of us in the area who started often as a psych and then sort of found that the traditional strategies we were using, training, maybe some post-consultation, just weren't making the effect, and it wasn't sustainable. And, you know, that's how a lot of us came to implementation science. We need more than that. So just talk a little bit about your journey there.
Absolutely. So then we started partnering with our colleagues who are these leading behavioral economists doing this work in health, but not so much in mental health. And I really feel like it's a parallel field, because when we first approached our colleagues, they didn't call their provider-facing work implementation science. There was, you know, a whole kind of field that was developing in parallel around, you know, leveraging the way that we make decisions. You may hear it referred to as heuristics or cognitive biases. I try not to over-anchor on that, because I feel like people have really strong reactions to being told that, like, the way they make decisions doesn't make sense or isn't rational. And that's really not at the core. It's just, you know, we've evolved to make decisions in, you know, rapid ways. And sometimes, you know, it leads us a little astray. And, you know, the choice architecture, the way the environment's designed, can kind of keep us making optimal, effective decisions. But so we then, you know, kind of went to look at the implementation science literature, and we didn't see that kind of thinking super well incorporated. So, like, if you look at the consolidated framework for implementation research, for example, you don't see these constructs with psychological biases or heuristics represented. If you look at the ERIC taxonomy, and Byron, I know you're here, and if you want to disagree with me, I would love a friendly banter. but if you look at that, you know, that amazing taxonomy that's been a huge contribution to the literature, you know, there isn't kind of a strong emphasis on these nudges or the types of strategies you would design based on harnessing and, you know, harnessing our biases to supercharge our strategies, if you want to think about it that way. And I will say I'm starting to see a huge paradigm shift in the field. You know, there were already papers that were kind of calling this out. You know, I think about Pothoff and Persaud have been writing about this, you know, habit and how that interfaces with, you know, physician decision making. And then just this year, just last month, I think, some colleagues out of Australia, led by Dr. Jung, wrote a paper in implementation science about nudges and really advocating for the field to start incorporating that thinking. But they're not intertwined as much as they could be. And I think it's really exciting that globally different research groups are coming to this conclusion. My hope is that going forward, we can start talking to one another more so that we can kind of learn from each other and not be reinventing the wheel. But for me, I feel like, you know, bringing these two strands of evidence together to supercharge or boost our implementation strategies, while also acknowledging that this is not going to solve the research to practice gap, but it's an important component in our toolkit, if that makes sense.
Yeah. All right. Well, then there's a good time to hear a little bit in a concrete way about the projects that you're working on. Just some examples of that. And I just note the reference you made to closing the research to practice gap, which those that are new to implementation science, that is why the field took off, was this concern that it was just taking too long to bridge that gap. And so the hard focus on kind of accelerating the use of evidence in practice to try and achieve these outcomes quicker. So let's hear a little bit about the different projects that you're running.
Yeah, absolutely. So we were really fortunate 4 years ago to get funding from the National Institute of Mental Health, which is our you know, federal funding agency in the United States that supports mental health related research. Through a new announcement that had just been released about 5 years ago, that's now a standing announcement called Alacrity Centers. And the whole purpose of the Alacrity Center was to develop interdisciplinary collaborations, leverage the best of various fields to accelerate, you know, the implementation of evidence-based practices and transforming mental health care. And so our idea was to bring in the behavioral economics angle, which I've just spoken about, but also participatory design, which is also kind of a key concept when you think about behavioral economics, is, you know, engaging your end users, your stakeholders, you know, not over-relying just on surveys and, you know, qualitative interviews, but also doing observation, something called innovation tournaments, which is basically like American Idol, but for ideas from, you know, clinicians, for example, about how their organizations can support them better. And so we tried to bring together all of these concepts within the context of this larger center grant, which is really about creating infrastructure to launch a whole new research program. The principal investigators of that center grant are myself, David Mandel, who's a colleague of mine, and Allison Buttenheim, another great colleague of ours, who's a behavioral economist. And so we had 3 projects nestled under this center grant, which were each at a different level of the ecological framework, meaning one was targeting patients, one was targeting clinicians, and one was targeting more organization level factors. And what we did was to try to understand how to kind of design implementation strategies that leverage some of the science from behavioral economics. And so in one project, which should be published any day, it's under embargo, so I can't say anything about the results.
You
but
academics
in the first project,
and your obsession with publishing, and we can't see, I mean, that is not bridging the gap, Renat. That is like widening the gap while we wait for your embargo.
In a week.
Go on. Please tell us about this paper we can't read. I can't wait.
Email me and I will give you the paper as soon as it's out, but nobody wants to upset the embargo gods. Essentially, what we tested was looking at patient adherence to antidepressant medications after they had been prescribed an antidepressant for, you know, major depressive disorder. And there were 3 arms. So one was kind of usual care where nothing happened afterwards. One was an escalating financial incentive where each week, so first week it was $2 a day if they took their meds. The next week it was $3 a day, all the way up to $7. And then the third arm was a de-escalating incentive. And we were interested in seeing if that financial incentive would affect adherence to the medication and also depressive symptoms. So the reason you may be thinking, well, wait, is financial incentives behavioral economics? And I actually got really confused about this early on. I thought behavioral economics was just paying people to do things. That was what I understood it to be in the early days. That's not true, because that's a rational approach, right? If you think that just paying someone will increase their behavior, that's like a transactional rather than a behavioral economic way of thinking about the world. But at any rate, because we were testing different ways of administering the financial incentives, escalating or de-escalating, and taking into account the fact that selective serotonin reuptake inhibitors, which are the medicines that are first line for depression, take 4 to 6 weeks to kick in, that was a really interesting kind of ecosystem in which to test that question. So that's the first project. Let me pause. Right. Robin, you look like you have a question.
No, I don't. I'm monitoring some questions on the side, but keep going.
Okay, cool. So then the second project was focused on trying to gamify and leverage social norms for therapeutic support staff who work with kids with autism in schools. So essentially the team created an app with a leaderboard to kind of amplify clinicians who are using data, which is the gold standard thing that one should be doing in working with children with autism spectrum disorder. And then, so social comparison or leaderboards, those kinds of strategies are highly aligned with the behavioral insights type of approach. And then the third project was focused on crowdsourcing from clinicians, ways that their organizations could support them in using evidence-based practice, trying to infer some of the behavioral barriers that might be getting in their way with regard to doing evidence-based practices based on their suggestions, and then designing a set of implementation strategies that took into account what we know from the amazing ERIC taxonomy and also from the behavioral insights literature to get a sense of what folks prefer. And really interesting findings there, and this isn't under embargo, so I can share that people way preferred financial incentives and way dispreferred social comparison strategies like leaderboards with regard to whether or not they use an evidence-based practice. And that's really interesting, because then you start to have to think about people's preferences versus what might be most effective. So those are just like a kind of a smattering of projects that we've been doing. I also have a new project that's just about to start that's about firearm safety promotion. Here in the United States,
highly appropriate for the US.
Has a firearm. There's an evidence-based practice for pediatricians to talk about safe firearm promotion. And we're testing a nudge in the electronic health record targeting the clinician versus a nudge plus ongoing support or facilitation. So half the clinics will get just the nudge, the other half will get the nudge plus facilitation to see if we need kind of to go beyond the nudge for this sensitive intervention. So these are the kinds of things we're doing. We also have some work in cancer care. It's really awesome bringing together these two fields. And I feel like there's so much work to be done. And I hope that the tent of folks who identify as doing both behavioral economics and implementation science just continues to grow. I think it'll be a really fertile area for growth.
I'm going to come to the questions on the side in a second, gang. There's some good ones there I'll highlight. But Renata, I do want you to comment for a second. I'm going to pick out, we have a wide audience that we aim to talk to in addition to academics. Why should policymakers care about behavioral and implementation science, like beyond studies that are generally done in academia? Where's the so what?
Yeah, I think that's such a good question, and I've spent a lot of time thinking about it. And I think it's our responsibility as scientists to show that return on investment so that policymakers feel like they're actually getting something from us and that we're not just doing this work to kind of publish another paper in an embargo journal or what have you.
That's right. And have me tease you about it. That's right. Go on.
Exactly. And I will say, you know, I'm so fortunate that I've had the chance to kind of both be researching these questions, but also advising policymakers. And ultimately, I think that you'll get to where you want to go faster if you can draw on what we know already, and you'll spend less money. And so, you know, when I think about the billions of dollars that we spend on scientific discovery and the fact that it never makes its way into practice, that just breaks my heart, because those are our family members and our community members who are not getting what, you know, their taxpayer dollars are paying for. And so I think that, you know, we have started to develop a pretty good understanding of, you know, context and its association with implementation success. We're starting to understand how to design effective implementation strategies. I don't think we have, you know, I can't say do this and you'll be successful. Like, I can't say that today. And maybe we can say that in 5 to 10 years. Maybe you can say that. And if you do, I want to know what you think it is. But I think we've learned a lot in the past 20 years. And I think it would be, it saves money and it's more efficient to draw on what we know to be able to, you know, to supercharge policymaking efforts to be more effective.
Right. And what about organizational leaders? What should they care? Is it the same thing as policy? Is it different? What's your thoughts on that?
Yeah, I mean, I think part of it is whether or not this, you know, for example, I'm going to use implementing evidence-based mental health treatments as my exemplar, because that's where I spend most of my time thinking. I think it has to be aligned with your priorities and your mission and your values for you to be willing to kind of put in the elbow grease that's needed to do the work. Like, I think that, you know, early on, we thought that implementation of, you know, cognitive behavioral therapy was going to be as simple as just giving folks manuals, giving them a little bit of consultation and calling it a day. Now, I think our thinking is so much more sophisticated than that. And it's really about creating learning organizations where people are kind of continuously learning and applying the best evidence that they have in that moment with that patient. And so I think if you're an organizational leader who has a mission of providing the best quality care, then, you know, these efforts are really aligned with that, but it's not going to be without cost and without, you know, resources needed. And so I think it's important for organizational leaders to know that you can't just pick up a manual, give it to your clinicians and hope for the best. If you're going to do this, you got to do it right. And it's probably going to go deeper than just CBT and be about improving your culture and your climate and working on your leadership and these kind of core factors that we know are important for effective implementation.
Very nice, because that's a really nice segue into a couple of questions. But those last points you made there are things that we are starting to understand from the science of implementation are important. And I would add that most of us got to this field through quite big failures of initiatives where we thought it was a straight cut. I'll test some behavioral strategies, I'll train a bunch of people to use it, or I'll use some dissemination strategies, and I'll need dissemination strategies to get it out there, and then nothing happens. Right. So a lot of us got here out of a bit of frustration of there's got to be more. There's obviously, it's going to take a few more things, like you're saying, culture, climate, all those things around the setting in which you want to implement. There's a couple of cracker little questions that I think are a nice segue. Let me ask this one, and I'm not necessarily starting from the bottom team. I think this is applicable to what Renard was talking about. Some issues we've faced, first they're thanking you for your interesting presentation. Then they're asking, some of the issues we've faced in using behavioral economics and science is the replicability and scalability of interventions. How can we ensure the research and studies are providing real-time feedback and applicable to a broader group? I have one idea I'm going to throw, but Renard, what do you think?
Yeah, I mean, so one of the things that my colleagues who are behavioral economists have taught me is the importance of the process of designing the nudges, that behavioral design process. It's very, very nuanced and complex. And so I think that if you're trying to take a nudge done in study 1 and applying it wholesale in study 2 without addressing some of those contextual factors and understanding the process, that you may not get, you're probably not going to get replication of your findings. And so, you know, and if you read the papers, there's only like 30 lines dedicated, if that, to, you know, the process of developing and what the actual intervention was. And so for me, it's about being really well steeped in the methods and understanding context, which is where it interfaces with implementation science. Because in implementation science, we're all about context and understanding how those factors are related. So I see that as being like an intertwining point, but I'd love to hear what you think, Robin, since I know you've been thinking hard about these issues too.
Yeah, I totally agree. Context is king, as people know I say 1,000 times, and that implementation science really helps you kind of pay attention to that and draw on what we know in terms of how the context will affect how scalable something is. There's also the question of implementing a widget in place is a whole different thing than thinking about scaling. So if you think about the literature, and we know a little bit more about implementing effectively so it becomes business as usual, we know a lot less about scaling and scaling sustainably. So they are kind of two different things, but I really like how you drew context in there, because I think that's where implementation science really finds its feet. Let me ask this now that we're talking about implementation.
Can I just,
yes, you can.
One quick thing about scale, and I want to be upfront and say, like, scale is like the next holy grail. I feel like I still have so much learning to do in that space, and I don't feel like the literature is really well articulated in terms of the science of scale. I think there's a lot of thought, conceptual piece. One of the things that attracts me to the approach that the University of Pennsylvania Nudge Unit, which Mitesh Patel leads, which I mentioned earlier, is that they're using the electronic health record, which is scalable. Assuming you have systems that are using similar EHRs, electronic health records. So, you know, that to me is really interesting. And, you know, he's actually been very successful at bringing together health systems now across the country in the United States to, you know, because many of us use something called Epic. I don't know if that's used in other countries.
It is, but most people won't know. Yeah.
It's basically the system in which, you know, people put in their orders to order your medicine or your test or your notes. And so I think that that's a really interesting, given the ubiquity now in healthcare of the electronic health record, although not in mental health care. So that's been a big challenge for us. I think we're starting to tap into some of the ways that this might be able to be scalable, but really it's the process that we want scaled, not nudge number one. It's the process of deciding to kind of use a nudge to change behavior that we want to kind of scale here, not just like the nudge itself, if that makes sense.
Yeah, really, really good. So let me segue slightly, because we're talking about implementation science. There's a question here. Could I pick your brains about how you might draw links between implementation science and design thinking? So close to my heart. Go, Renat.
Yeah. So, you know, when I think about design thinking, I think about user-centered design, participatory design. Here's another place where there's a lot of terms, but that's what I'm intuiting in your question. I have a colleague, Erin Lyon, who's at the University of Washington, who also has, you know, an Alacrity Center that's led by Pat Arian, who's another colleague, where that's like a core, that's the core piece of their emphasis there, where they're thinking about how to design our interventions, not our strategies, our interventions, the things, as Jeff Kern would say, or the evidence-based practices more effectively. And there was a piece just written by a colleague, Alex Dopp, that's all about kind of design thinking, user-centered design, and how it could be applied in implementation science. I see this as another Venn diagram, right? And what we do best in implementation science is we draw from the best of other fields to try to understand how to change behavior and to be more effective. And so I think in the coming years, we're going to see a lot more of this. But Robin, would love to hear your thoughts, since I know this is something you think a lot about.
And by the way, the DOPP article that Renat just referred to, if you follow a few of us on Twitter, it's an open source paper. It's really good and worth getting onto. But look, implementation science has the word science in it for a reason, right? And the thing that really draws a lot of us to it is it's literally testing, trying, learning, publishing, sharing, being transparent with data, being transparent with evidence. I've been involved in a lot of design thinking activities, and you can see some of the processes that are similar, but it'd be great to see the design thinking field also think a little bit more kind of in a structured and scientific way. That is, being really clear about what strategies they're using, being clear about what works for who in what context, dropping things if they don't work. It can sometimes feel a bit formulaic. And the struggle with implementation science is they're often looking, so if people approach Center for Evidence Implementation to do some work, they kind of want our implementation plan now, like it's the same, and it's, you know, you follow the same steps. And of course, you'd be tailoring your implementation strategies for what it is that you're trying to achieve, for who it is that you're working with, and the organizational context. So it'd be good just to kind of, and I think that Aaron Line and his work and that team are really trying to bring that together. Aaron Line's very good on Twitter for folks, and he did a cracker tweet a couple of weeks ago, having a bit of a shove at design thinking. So it's worth going and looking at his Twitter feed. I want to know though, because there's some thick and fast questions coming in. There's quite a few about the way behavioral insights has been set up across government, and I'm not sure if this is as common in the US as I know it is through our colleagues who are on the call now around the behavior insights team. So it might be that those questions are better directed at Rory and Alex who are on the call, but there's a question here. Let's see if we can tackle this. Behavioral insights have captured the imagination of politicians, and I would give David Halpern an enormous amount of credit for achieving that over the years, and the BIT team for really kind of leading the pack and doing that. But work done, this person is classifying possibly as low-hanging fruit. I know that sometimes some of the concerns people have about BIT, and the BIT guys will be able to comment on that better. What can implementation science learn about getting into politicians and senior executives' ears, Renard?
Yeah, I'm just writing it down because it helps me to see it. So, you know, implementation science has not captured the fancy of high-ranking executives or politicians the same way the behavioral insights crew has done, and I think that's our fault. Implementation science is not the sexiest moniker for a field. People don't really know what it means, and is it a science? It's actually interesting. Last month, I think it's the Queen of Jordan wrote a piece in CNN, which is a big news outlet for us in the United States. And she used the term implementation science.
Really?
And I nearly leapt out of my chair. I actually took a screenshot because, like, I'm going to put it in my talks because we finally made the big time. But she was referring to it within the context of cancer care and some of the work that she's been doing in Jordan around cancer care. And of course, implementation science has gotten a lot of attention within the delivery of cancer care, I think both domestically and globally, domestically being here in the United States. But I think that we have not done a great job marketing what we offer to high-level folks. And, you know, I've been spending some time talking to health system leaders and making the case for why implementation science is important. And I have a colleague, Jonathan Pirtle at Drexel University here in Philly, who's trying to think about how to use dissemination strategies to tap into understanding policymakers. But I think we could learn a lot from the behavioral insights crew about how they got the ear. And so I'd love to hear from them because I don't feel like this is an area that I'm expert in.
You know what? I did get some feedback from the head of he's a good colleague again, David. We suffer in implementation science from too many frameworks. So we've really complicated it by publishing over 80 different frameworks. Some are quite intuitive to use, some are extremely complicated. And
Sure.
He did give me some feedback. Rory and Alex will recognize this. It wasn't feedback I invited, but he very kindly said to me, I think the problem is you just have too many frameworks. It's too confusing. So I think you're right, Renard. There's a bit of work to kind of, and I think what the BIT team has achieved is getting that science out to policy and practice and getting it out of necessarily academic institutions, which often, you know, because of the incentives and the things that you need to achieve, have to kind of publish and write in that particular way. Renata, I'm going to ask you, we're fast running out of time and we've got so many questions, but I just want to hear from you. What is, in your opinion, in your work with behavioral economics implementation science, what are the hot topics? Where's the future going? What are the challenges? Where What's on the next horizon? You've already mentioned one that's scaling, but have you got some thoughts on that?
Sure. I think one is related to kind of more precision-oriented approaches to merging these fields. And what I mean by that is there's a great paper, I think by Shlomo Benartzi, I think I'm getting his name right, it's called Nudge Me Right, but it's basically kind of,
it's
pretty good.
Nudge
It's really
Me Right.
Good. But anyway,
I dare somebody to Google that.
Moving away from these kind of law of averages approach and thinking about like what works to nudge you, Robin, may be different than what works to nudge me, Renad. So I'm a little bit interested in this idea of trying to understand better, like the more personalized approaches. You know, and another thing is figuring out for which behaviors behavioral economics is best suited to be applied in implementation science. You know, it feels a little bit difficult to apply some of these concepts to really complex repertoires of behavior, like implementing CBT or cognitive behavioral therapy. There's so many pieces, and thinking about how you leverage behavioral insights to make it easier to use cognitive behavioral therapy. Maybe it can make it easier to remember to set an agenda, which is a core component, or to assign homework. But the way that the repertoire rolls out is it's not like saying you need a flu vaccine today, Robin. It's a different way of kind of interacting. It's more complex behavior. So really trying to understand when it's the appropriate approach. And then for me, I think there's, you know, I haven't talked about this a lot now. I will in March because it's kind of a core part of what I've learned over the past 15 years. But this is not going to be a magic bullet. Like, we're not just going to apply behavioral insights and implementation science and like take off our hats and retire and, you know, call it a day. I think it's a combination of these types of approaches plus the hard work that needs to happen around changing organizations. And that's a heavy lift, you know. It's one thing to change an electronic health record prompt. Like, that costs money, but like it's not that hard at the end of the day. Changing cultures and climates, leadership, you know, I think these are things that we cannot ignore, and they must occur for effective implementation. And so I'm interested in the intersection of, you know, behavioral economics. And I'll tell you, for a little while, I was like, oh, this will just solve it. Like, I don't have to do all this hard work in the organizational change piece. But like, I really think it's at the intersection of kind of what we've learned about organizational factors and their relationship with implementation success, and changing the environment to support implementation through choice architecture, where I'm really personally excited.
Yeah. Ditto to all of that, for sure. And the heavy lift, just to emphasize that, it is a heavy lift. It is, we need some insights from behavioral economics to keep people motivated in their implementation efforts.
Right.
Because boy, is it hard to keep, you know, it's hard to help people stay with the plan and keep motivated and do that heavy lift, that organizational change, that kind of ecosystem change. It is tough. It's easier to go back to business as usual, which is what has been shown to not generally work.
And the DIT team has this, and I pulled it up before the call. They have this piece on applying these insights to how government makes decisions. So it's like meta up a level.
Yeah, they're very good at that.
But it's the same thing. So good. But it's the same thing for organizational leaders of health systems or mental health organizations. You know, none of us are kind of immune to some of these quirks about how we think and make decisions. And so I think there's just a lot of interesting stuff up there.
Yeah. Okay, give me the two big challenges then. What's getting in the way of progress? What can we do?
I think, like, if I'm drilling down into applying these insights for mental health, I think one is just that some of the most exciting work that I've seen done in healthcare has been leveraging electronic health records, and we can't do that in mental health care, at least not in the United States, because many of our groups don't have they still have paper charts, and they all use different ones. So that limits our ability to apply some of those analog situations. And so I think that we need low-tech ways to apply behavioral insights, and then the scalability issue becomes challenging. The other thing, and I don't know if this is an issue globally, but certainly in the United States for mental health care, it's tremendously underfunded, and our group talks about Maslow's hierarchy of needs. Our community mental health organizations really are very strained, and they want to do these evidence-based practices. They think all these things that we talked with them about, they're all our very close partners, are great ideas, but they're struggling to keep the lights on and to get their folks paid. And so I think it's also a reallocation of resources and really acknowledging that mental health matters and is important. And that may happen because of COVID-19. There may be increasing understanding of how important mental health is, and I'm hopeful about that. But I think we can try to do all these things and be really smart about applying concepts from behavioral economics and implementation science to improve mental health care. But in the absence of the basic resources that are needed, it's going to feel like a unsurmountable task.
Mm-hmm. I think we have in the other countries CEI works in, so Australia and Singapore in particular, different to the UK. COVID has certainly, not only particularly in Australia, injected an enormous amount of money into the mental health field. And in Singapore, you can see it really picking up. We're doing some early emerging work. What I would say, and there's some mental health colleagues in Australia on this this group here, is everyone's doing their best to make sure this stuff is evaluated. The appetite for spending money on evaluation, unfortunately, in Australia is disappearing a little bit, and or spending adequate amounts of funds on evaluation so you can do a nice rigorous design to answer that question and not have to cut too many corners. And we possibly are in a little bit of trouble with COVID, where people want to, action things, but not necessarily kind of evidence that those are the things that will work and or improve. So there's a few of us slightly worried. Singapore, I'd say it's different. There's a big appetite for doing, but also testing. So, context is king, I suppose, on the point of that, isn't it?
Yeah.
Renard, do you have any last thing you'd like? Queen, that's right. Thank you. And I'm looking up that Queen of Jordan thing. That is a top tip. Any last sort of words?
I can send you the
almost
link.
Out of time. Anything you'd like to sort of go out with, like a zinger, a taster for March?
I think that I hope that this engenders a global conversation, and I'd love to learn from the colleagues all around the world doing this work, calling it the same thing or different things. I think that we could really learn a lot from one another and be moving faster. One of the things I worry about is that people are going to grow antsy or impatient with implementation science, because we've been at this for a while, and in our implementation science practice gap is growing, which is wholly ironic. And Robin, your book kind of really highlights that very effectively. I think as a science, we've tried so hard to be legitimate and say we're a science. And so we've gotten really mechanistic, and we're trying to understand all this stuff related. And at the same time, I think we have to keep it applied and actionable and rapid. So I think we have some challenges ahead of us, but I think if we can come together as a global community, I'm very hopeful about the future.
Fabulous. See, everybody, rockstar, absolute demonstration. No need to say. Thank you. Could you put the closing slide up, Joyce, so I can get people as excited about the next webinar as this one has been? Renard, you are truly a rock star. And how fun. You and I could just, I don't know if anyone would ever want to listen to us, but we could just go for like hours. It's like chit chat, drink bourbon. Renard and I were talking about before the things we miss. Bars. We both just want to go to a bar, sit in a bar and have a drink. And one day we will be able to do that. In the meantime, in lieu of that, we will keep these summit webinars going to the end of the year. They've appeared to be quite popular. And again, get your abstracts in. We never, ever extend abstract closing at EIS, ever. So please, if you missed the date, I can't help you. We need to design a really fantastic program for everybody. So you've only got a couple of weeks left. Our next webinar in October has very special guests, Mark Rickinson, who's on this call now from Monash, and the first ever director of the National Evidence Institute focused on education, Dr. Jenny Donovan, which is super exciting. It's essentially one of the first big efforts around what works in education in Australia, large investment. Myself and probably one other person speaking about research translation and implementation in education settings. Mark does some really cool, innovative work on research translation. So hopefully you'll all join us. Thank you very much. This will go up on the website if you'd like friends to join. Team behind the scenes, can we make sure we capture all those questions? We might want to send them to Renard. There's a few she would probably like to respond to. We've got some, so if we just make sure we get all those down. Thank you for your participation, everybody. Have a safe day. Don't touch each other. Wear a mask. Wash your hands. Thanks very much. We'll close it there.
Thank you.
Thank you.